Okay, all right. We are going to be doing this live, our first time. So I'm going to share my screen so everyone can see the PowerPoint, and then we will make the PowerPoint available afterwards. And this is also being recorded. So that way, if anybody needs to refer back to anything, they could get the recording. Can everyone see my screen?
I can see it, Teresa.
Okay, great. And then I want to remind everyone that's on right now, if you would mute yourself so we don't have the background noise and things like that, that's always helpful. And then when, of course, you want to ask a question at any time, of course, unmute yourself so we could hear you. And we'll get started here in just a couple minutes.
Will this be posted on a recording online, or are we able to record it ourselves?
Yes, we're recording it and we'll make it available online.
Thank you very much.
Absolutely.
Kathy Harms.
Join the meeting.
Oh, you just haven't got one to even tell.
Yes. I never even heard of that.
It was weird.
Okay, so talking about exploding.
All right, Bruce, it's 10 o'clock.
Are we ready?
Yep.
Can you hear me? I'll take that as a yes. So a couple of people just came on. First of all, thanks for joining us. Welcome to our Zoom meeting presentation. I hope everybody's doing well. For those that just came on, a couple of housekeeping notes first. So we are recording this. We'll post the recording on the request for proposals page of our website. And I think we're going to also just reproduce the slides on a PDF if you'd like to have that.
I did kind of go through a little bit of October, but I won't really.
And then the second item is if you're not speaking, can you please mute? Thank you for the reminder. Just to keep the feedback down and let everybody hear, so we'll appreciate that. Do we need to ask folks to introduce themselves, or are we able to track that without taking time?
Everyone, there's been a couple messages in the chat, and so if you can just indicate your name and title and your organization, then we'll have a recording of everybody that's present today. So appreciate that.
Perfect. Okay, and this is a public meeting, so we like to be able to document who was a part of it. That's the reason that we asked. So with that, and out of respect for everybody's time, let's dive right in. So I believe Teresa is in command of the slides. Or Taryn, perhaps.
I am. Go right ahead. Just tell me when to advance to the next slide. I've already done so. So
Okay,
you've got this one.
We're not seeing the title slide on the screen yet, so you may have to.
It was already up there.
Yeah, I won't know what the title of it is until you show us.
You may have to reshare, Teresa.
There.
It's showing I'm sharing.
Yeah, I've got it. Okay. Now we're going to start. This is the pre-proposal presentation for Safety Net and Children and Families. Agencies eligible to apply are previous grantees. So if you're not currently with a contract with us, there are other funding programs available. This is for currently funded organizations. One other disclaimer is that we're not going to go through item by item. The purpose of this presentation is really just to hit the high spots, talk about some questions where people
Join the meeting.
We're going to talk about some questions where people frequently have problems or highlight new areas. And then I think the other thing to tell you agenda-wise is that at the close of this and after questions, if folks want to go deeper on navigating our portal, then Susan will stay on and do that with you. If you're navigating the portal okay, then you don't need to stay on if you don't want to. So with that, let's go to the next slide. So current grantees have a username and a password. And if you go to any page on our website, on the upper right-hand corner, there's a little box to click on that says login. So That's the place to go if you want to start applying. Thank you. And so there are several forms that you go through, and we hope it's pretty self-explanatory. With the email that you received from Susan with the announcement, there's a great attachment that gives you specifics about navigating through there. Sort of click on this, save, then click on this. And I'm not going to repeat that. So again, that was an attachment that your agency received as part of our initial request for proposals. So if you haven't seen that, then get with the contact person at your agency who receives that. So next slide, please. Okay, there's the place to log in. There we go. Susan, do you want to take this slide, or is this
Yeah.
mine?
Yes, I can go ahead. So earlier this month, we sent out a revision of our service unit definitions, and you can access that on our website as well in the required forms section. So a year or so ago, what we did was try to set costs for all the eligible services that can be proposed, and didn't get all of them. And then we have since, the newer revised version is pretty much all service unit costs that have been proposed in the past. The price has been set, and for some, it is not yet set, and there's some details on that that we can address later when we get to that section. So you won't be able to actually enter a unit cost. It is already set in the document in the portal when you're adding your services. We can't stress enough to please spell out.
Kathy Doherty.
Welcome, Kathy. Please spell out acronyms.
Join the meeting.
The Board of Trustees are the readers of these proposals. Every year we let you know they actually do read them. And if they see an acronym and they don't know what that is, it's distracting, and what you're trying to convey just simply doesn't come across as well as you would like it to. So please spell out any acronym that you may be using. There's character limitations or space limitations on most all of the areas that you're going to be entering information. And that is intended to assure that you can be very, very brief. Even putting things in a bulleted format is more than adequate. We just want to cut to the chase and simplify and get the most important information out there. Some of the questions will ask for data, and we're looking for numbers from your own data that you're collecting regarding outcomes or other information. So some of those aspects, the acronyms, data requirements, we may ask for some redos on those sections. So just please be aware of that when you're going through the application. Next slide. The agency information section on the application are the contact information, and I want to stress that the information that is put in there for the contact is the contact for the person that's actually responsible for and completing the application. Make sure that that matches up. There's a messaging component on the application, and so messages are going to go to and from that individual. The other documents in this section are ones that you are familiar with, such as the agency audit, the revenue and expenditures for the organization, your language access plan. No changes there. And Rochelle, take it away.
Thank you, Susan. So this next section is part of the application information that you'll be filling out. Next slide, please. So you'll see questions 1 through 2 are the same as in previous years, except for question 2B. And so we changed the structure of this question to bring more clarity to what we're looking at. And so one example would be that if your agency's overarching approach is trauma informed, that what we're looking for is how you assess and measure your system and making sure that it's being applied appropriately. So that's one of the questions that some of the time we have people who kind of get off track. We restructured that question to try to bring more clarity. Next slide. So you see question 3 is the same as previous years also, but what we did was add the little help buttons at the top to provide more clarity. One of the things that we know a lot of people kind of have issues with is the indicator of meaningful improvement and functional outcomes. So we have those hover, all you have to do is hover over it and it'll give you a definition and information on what we need for each of those sections. Question 4 has changed. In previous years, it was a yes or no question. This year, we're asking you to provide 2 examples of how outcome data has changed or improved your program. So in this question, it's just how has data helped your process improved, or you've changed how you deliver or did program guidance. Next slide, please. So question 5 is the same as previous years also. The one thing that we do want you to pay attention to is the total at the bottom. Since we have went to this electronic form, some of the time that does not total the numbers for the number levy funded or the total number in agency. So we just ask that you make sure that you total those numbers, because if you don't, we will send that back. And so next I'm gonna hand it back over to Susan for her to continue the questions on the application.
Thank you, Rochelle. These are similar questions from last year. We are interested, the Board of Trustees is interested in major changes that have happened since you submitted application last year. We know that everyone has been significantly impacted by COVID. We're not really so much looking for what your maybe precautionary things are to protect folks within your organization, but really in terms of, you know, how has it impacted the population served, how services are being delivered, and certainly any revenue issues that are happening with that. And also positive, some organizations are looking at delivery of services quite differently in post-pandemic times. So just an update there. Question number 7, this is the same. Is there a formal policy and procedure in place for keeping participants engaged in service? If you do have one, the application will prompt you to upload that document. Next slide. Again, similar questions as last year. List major non-levy sources of funding. In the use of funding, we're looking at something, you know, like if the ABC Foundation is providing $100,000 a year for transportation, or so something specific, not just general like staff salary. And then major partnerships that are assisting participants with basic social determinant needs. I will tell you that this is not a perfect world, and that there's a link to give you some more information about social determinants. And at my last check, that link was not functioning, and so we have a request in there. Just the language, social determinants, very familiar to a lot of you, but in past we've gotten responses on this question that suggested that the organization wasn't really partnering very much for addressing social determinant needs, when we know just from knowing the organization that those needs are being addressed all the time. So we're talking about housing, food insecurity, employment issues, health issues, that sort of thing. So just dive in a little bit deeper on social determinants on your own if you have any question around that.
Susan, can I say something real quick?
Yes, please.
Also, in the past, we've had some people that will say the social determinant is mental health and the partnering agency's name is the Mental Health Fund. We already know we are a partner in addressing mental health issues and funding your agency. So we don't need to know that. That's not what we're looking for. As Susan said, we're looking for other social determinants. And if there are other partnering agencies regarding mental health, we're more than likely aware of those. So really looking at those housing, transportation, education, food insecurities, those types of things. That's it. Thank you.
Thank you, Teresa. Next. I'm just reviewing the questions. Number of levy participants newly enrolled last year. Is there a screening? Is there a policy or procedure for screening benefits eligibility? Again, if you answer yes, you will need to upload a document with that policy. Documents translated in other languages and what they are, and what interpreter services are used in the delivery of mental health services. And if you are proposing levy-funded school-based mental health services, yes or no. There's no upload here, but just very briefly, and this is also outlined in detail on our service unit definition document. Essentially, our definition of school-based means that that service is being provided on school premises, whether that's a therapist providing therapy to reduce access barriers and providing the service at a school, or if your organization has an actual program that is provided on a school setting. Lastly, number 15, this is the section that if you have any significant changes to your application in terms of the expenditure plan and how services are being distributed, like let's say you are no longer providing individual therapy because you have a new funding partner to address that, and then therefore you're shifting those units that you were proposing for therapy to another service. So major changes in services proposed, or the amount of services distribution is what you're going to want to address in this one, different than what was proposed last year. Next slide, Teresa. The additional documents section on the application are project forms that you are familiar with. And so this is your home page for the application, and this is where you'll find it, the additional documents. And next slide. So what you'll see here is personnel summary, documentation of staff licensure, the cover page, and the line item budget. And so also on here, you'll see that there is a template for each one of these. The personnel summary, the cover page, and the line item that you can access here as well. Next page. The expenditure plan. So this is automated now. You're not having to do the Excel worksheet. So you will see under service, when you click that, you'll get a drop down for all services that are eligible to propose. You will select full or partial on the funding type. The unit of measure, that would be hour per person, per day, etc. And then the cost per unit, that is going to be a fixed cost in all likelihood. There are a few services, residential treatment being one, that doesn't have an assigned cost per unit, and organizations that are providing a service, there's just a few that do not have an assigned cost already. If you have particular questions, feel free to contact me about those specific pieces. So you're going the unit cost generally is going to show, and then you're going to indicate how many units, whether it is an adult or child service to be provided. And then the total cost is going to be calculated for you. And then if you try to save it at that point, you're going to get red outlines around the eligibility and discharge criteria. And so you need to complete those for each of the service that you are proposing. And we are looking for the clinical eligibility. What is the reason that the service is initiated or is being provided based on the mental health issue that the person is experiencing, and then the discharge criteria. Next slide. So this is back on your home page. There are a couple of options here to help. The first one on the right there, it says show incomplete items. If there was any question or section that asked for something to be uploaded, and you click on that button, it's going to highlight areas where there is information missing that you're going to want to go back and check. In the center there, you can view your application, and then there will, I think you have a picture, Teresa. Yep, there will be a print function. Just print or click the printer icon and you can print the document. And then so back, yep. And then when you're ready, you can either save the document to continue later or go ahead and submit it for review. All right. Bruce?
So this is the final section of the more formal presentation. And then we're going to come back and do a couple of things. You can send written questions. We're accepting those until September 22 to the address there. And we can do questions now, but my disclaimer is that if we get too specific about, oh, I've got so many clients and so much per hour in this building and so on, that doesn't work for these kinds of presentations. So we want to try to do general questions today, kind of about either the request for proposals or application information. And if you've got nuts and bolts kinds of questions, feel free to email those and we'll post the answers. And we're usually very, very quick on posting the answers. We say 48 hours, and that's a promise that we'll keep. Usually it's closer to 24. So next slide, please. So we mentioned acronyms before, and there's a reason that we're mentioning it again, is because it's frustrating for the reviewers. And I think that for some, this may be new information about how to handle this. And so I do just want to show you the way that we're suggesting that you handle this. So in community mental health, there's a lot of stuff that gets initials. And so we gave an example here, the basis. And so although we say no acronyms, please, you think that basis is a word, but it actually stands for things. And our board is well used to the world of mental health, and they know a lot of stuff, but we're also very broad in terms of ages and types of agency and severity and so forth. So not all the acronyms make sense, and you don't want to cause furrowed brows with your proposal, do you? So here's a little hint for you. So if you have this scale that you're going to be talking about, the first time, spell all the words out and then put the initials in parentheses, and then after that you can just say basis. It's become enough of an issue, and there are several things that we give as helpful hints, but if we can't process your application, then we'll return it and ask that stuff be redone, and that could add some time to the processing. So that's the instructions on acronyms specifically. Next slide, please. So here's a little timeline, and it just shows when we're accepting questions and then when we'll post the answers. So the due date is all over stuff. There it is, October 9th. And that is by 12 noon. And the reason that we do that is because we want to process things the same day. So it's not just the 9th, it's the 9th at noon. Next slide, please. So this is not exactly new, but it's new-ish. And so we run into problems, and many of you do too, when the payment and the billing get out of sync. And so there's now a 30-day due date after the quarter, and then billing follows that. And then at the end of the year, there's a demographic report, and it's the same deadline for that. So 30 days for all that stuff now. And this is a January 1 contract year. And so the same logic applies. As soon as you're able to close out fourth quarter, that's great. We're not going to do the first payment or distribution, we say sometimes, until we get that and the annual demographic report. And that just keeps everything in sync. I think this is the second year we've done it, and it's been surprisingly easy. I hope it has been for you. Everybody's done a great job. So we're kind of still in this schedule now. Is there another slide? Okay, so let's do this.
Just a second, please, Bruce, excuse me. So we have a couple of questions that have come up in the chat. One, Shamika, this application, can it be started and saved? Yes, it can, so you can come back to it. Another question, Kathy, can multiple people sign in and work on the application with their own sign-in information? Yes, you can. The distinction about the contact information at the very beginning is, again, the message feature. that will go to the designated person listed as the contact. But yes, multiple folks can sign in. Miriam, October the 9th at noon Central Time, yes. That is correct.
Not Greenwich Mean Time.
Kathy, what's the best way to download a copy of the application as submitted so we have it for our records? Good question. We do not have a good solution to that yet. So on here, honestly, you're going to have to print it out. And if you want to scan it to create a PDF, we do not have a save to PDF function. Hopefully that will be added soon. Right now you have to save it. It saves as a web page. And so it looks kind of clunky when you actually then open the file. So apologize for the archaic nature of that, but we're working on it.
Let me give an opinion also on that topic. I think one of the dangers of saving what you've submitted is that for some people, when they're in a hurry, they attempt to reuse answers from prior years. And so it seems like it's a time saver. And what we found is we adjust these questions, most of you know, a little bit from year to year, and the change is enough that you can't reuse your answers. So people that want to cut and paste stuff from year to year run into problems at review time. So just that's one of the reasons that I'm not too preoccupied with saving answers, because even though we say reuse and recycle, not in this case. Are there any other questions?
There's one more from in the chat. Will the contact person for the application receive confirmation once it is submitted? Yes. You will also, as we as staff go through and review and approve or deny aspects of the sections on the application, you will receive a notice of that as well. Melody, my sign-in credentials from last year's application, can they be used by the agency?
My
Yes.
credentials don't work from last year.
Okay.
So
So
I wasn't sure if that was standard or if I might be using the wrong information or if I just need to contact you.
yeah, contact me because there are this is a different application from last year. We were using FormSite last year. Now it's on our portal. So anyone that needs a new login, just email me and we can set that up for you.
Susan, I'm seeing a question here. Let me give the initial response and then you can add to this. So the question, and I didn't catch who it was from, but it was something to the effect that are all services on the service unit definitions something that we can apply for? And so are these all available for billing? And so it's a good question, short question that gets a long answer. And so the first thing that I want to tell you is that we compare what organizations build from year to year. And so there is a question that we talked about briefly. It was on the screen and I'll mention it again. And the question asks, are you proposing things different this year than you have in years past? And it's specific to that. And so that if you're going to be looking at substantial changes, pay close attention to that question. And we really, the best answer we really want is data. So in order to be able to say, you know, X number of people ask for the service and we want to be able to expand and provide that. And if you're reducing a service, the same logic applies. So that's the first thing. It's not just sort of apply for whatever you want to. If it's a change, then we'll be looking very specifically at why you want to do that. And then other questions flow from that in terms of our understanding of your program, the ability of staff given their credentials of doing that, and how that integrates with other stuff towards the outcomes and impact that you're telling us about. Susan?
Okay, couple more questions. There is one about mental health services being delivered in a preschool setting, that if it's something specific to your organization and this one is, you can just get in touch with me offline and we can address that. Here is another question. Is there a downloadable application template so we can work offline before uploading? Very good question. No, the best I could suggest to you is to, on the page that you're seeing here, click the view application and then print that out. So you can have a hard copy to view in front of you while you're working on it. Other general application questions, if we missed something in the chat, or apologies, but please go ahead and speak up if need be.
So send those via email if there's anything that occurs to you later. So with that, shall we proceed to the portal?
Yes, we can. So this will just be very informal, and I'm not going to say anything about my expertise and navigating.
Susan, I'm going to stop sharing my screen.
Yes, you have, yeah.
Okay.
So folks that want to, that are actually filling out this application and want to walk through, please stay on, and that's what we're going to do. So I'm going to give just a couple of minutes here if folks are needing to log off, or for whomever would like to stay on. Everybody can see my screen? Okay, so here we are at our home, at your home page on our website. This is the same thing that you're going to come in. Well, actually, let's go back. Okay, so here we are. And this is new. We have a new logo we're very proud of. We haven't done a formal unveiling of that, but that is new. So from any page on our website, you're going to go here in the upper right and click Login. And that's going to get you to your, actually, I was already logged in. So you're going to see another screen where you put your username and your password, and then you're going to get to this page. From here, you're going to click on Applications. If you have submitted an application before, you're going to see it here. But for this purpose, you're going to create a new application. Going to come to the grant category, click on your grant. And for grant name, this is, I'm going to click here, and then you're going to see a bunch of options here, because that is information that I've already entered into the system during other applications. your grant name, I'm pretty sure for everyone applying for Children and Family and Safety Net, is Core Services. This grant name is not something that folks may be very familiar with because you don't really use it all that often. It is the